Thank you. Happy Friday. And thank you to Margaret for inviting me. Thank you, Dr. Afable, and my fellow panelists. This, I think, will be a really great session. And thank all of you for not leaving after the last break and staying for the last panel. So thank you all. It was interesting, this panel, we really didn't get a chance to talk prior to today. But I can tell you now, after sitting through my now panel colleagues' presentation, it's like a carbon copy without the pictures of the MRIs. I don't do those. So let's go ahead and talk about what I do talk about, health policy. And health policy, as we know, is embedded in the process of allocating resources. And if there were enough resources to go around and cure everything that we needed to have cured and to serve the people in a way that need to be served, then health policy would be really easy. But for some reason, it's pretty difficult. It's hard. There are a lot of competing priorities. This chart starts to show why. So I'm going to start at the macro level, up at the federal government, because we care about the fiscal health of the federal government and of the states. So let's take a little walk back in history. This chart shows the federal deficits going back to 1967 through today, and then the red bars represent the most recent forecast put out by the Congressional Budget Office, and this is after the passage of the Tax Act in December. So these numbers have been updated. There's a dashed line going across the chart. That represents the average deficit as a percent of the GDP over this period of time. When I look at that dashed line, and I look at those red lines coming up in our future, I see that those red lines going down are twice the size of the average deficit we've been experiencing over the last 5 decades. So what has that resulted in? Well, when you have deficits and you spend more than you have, I don't need to tell all of you, it creates a buildup of debt. This picture goes back a little further. It goes back to the 1940s. It goes back to when the United States debt was at its highest in modern history, and that was at the end of World War II. So we see how that wall of debt came down over the years, went back up, came down after the dot-com era when there was more money into the economy, and then we started to go into a recession again, and that wall of debt has been growing. The projection is in the pink, and the reality is in the red. And the CBO says, everything being the same, considering the new Tax Act, considering what they consider to project going forward in an unbiased way, this is the amount of debt the country is going to accumulate over the next decade. The debt is expected to reach 100% of the GDP of this nation. It doesn't sound like a lot of resources available for allocation, does it? Let's also take a look, since we're in California and we have this great weather. I know it's been a little cold, but I look at my friends across the country in different states, and there's some really harsh weather out there. So when we come here, I woke up this morning in Sacramento and it was 29 degrees in Sacramento, which that hardly ever happens. Before my plane took off, they had to de-ice the plane in Sacramento. I texted my husband. I said, do they even know how to do that? He said, it's okay. So yeah, it's a little chilly, but it's a really great state, really great weather. We have a lot to offer this country, our citizens, the people of California, and really a lot to offer the world. But we care about the fiscal outlook in the state. So I took the most recent Legislative Analyst Office report, the LAO report, nonpartisan. They did their fiscal outlook for California. They said, we're going to finish the 18-19 fiscal year budget year, and we anticipate that California will have a $19 billion reserve. That's phenomenal for California because we haven't been in that position in a long time. But like any financial person, they said, but wait a minute. We have some concerns and there are some uncertainties. We have uncertainties in three major areas around the state's fiscal outlook. Uncertainty in revenue, uncertainty in federal decisions. I wonder where they came up with that. And then some uncertainty around some notable costs that could be coming the way of California. So let's talk about some of those uncertainties first. The revenue in California, the state general fund, 95% of the state general fund revenue comes from three sources: personal income tax, sales and use tax, and corporate tax. And of those three taxes that create 95% of the state's revenue, one of those makes up 72% of all that revenue, and that's the personal income tax. And the personal income tax structure in California is probably one of the most volatile of all state economies and financing mechanism. We place a very high tax burden on the highest wage earners, capital gains, others. So when the economy starts to falter, the revenue immediately falters for the state rather than building on a more stable base. So they have concerns around the revenue. They have concerns around federal decisions. I don't know why. Certainly in the area of healthcare, certainly in the area of taxation, and in other areas. I think that's a wise item to have on the list of uncertainties in the political uncertainty that we continue to go through right now. And there's some notable costs. They're not sure what impact that is going to have on California yet related to the wildfires and the mudslides. Billions of dollars, millions, hundreds of millions of dollars, if not billions, have been spent on debris removal, remediation, aid to families who've lost their homes and others. And the state is not yet sure what the size of all those costs are and whether or not there will be non-state revenue to actually pay the state for that. If there's not, there's going to be that cost burden for those expenses. So that's the uncertainty. Now, I flipped the page of the LAO report and they had the short term that I just went over, and they also had a longer term. And I have to chuckle. Is anybody here from the LAO's office? Okay, well, I'm going to chuckle a little bit. They said there are two possible scenarios going forward. Economic growth or recession. Enough said. But I think that's a reality. So why do we care about the federal government and the state fiscal health? Well, because almost half of healthcare funding comes from the federal budget or the state budget. The rest is made up from households and from private business who suffer when the economy goes down. So we care greatly, and those items are at the backdrop of health policy because the resources are scarce and folks have to determine how to allocate them. And to put the hospital perspective on it, we care because of every healthcare dollar that's spent, hospitals take about a third of it. About a third of that goes to hospitals. So that's a lot of money. And the rate right now is probably close to about 3.7 billion, probably almost 4 billion, trillion in spending. That's a lot of money. Health sector, hospitals. So we care. We care about that because we have a lot of folks in Medicare, a A lot of folks in Medicaid, which is Medi-Cal in California, and employers are covering a lot of folks as well. Let's take a look at hospital care. I like to look back to know where we're going to go forward. And this chart is very helpful to me. It's about a year old, but the numbers are still very relevant and the same. It compares 2 points in time, 1980 and 2014, so essentially 3.5 decades. And if you were to line up a dollar bill next to those two bars, it would show you the distribution of that dollar bill into what sectors of the healthcare economy. Back in 1980, hospitals consumed 43% of the healthcare dollar. It was a lot. It was a big deal. It's a big deal when you have to go to the hospital and it's expensive and people get sick and we make them better. We look at where we are today, that number has gone down significantly. No other sector in healthcare has pared down its consumption of the healthcare dollar in any relation to what hospitals have done, to what the healthcare industry has done. And that's attributed to more home and community-based care. It's attributed to getting better at care management, at care coordination, at integrated care, at technology so that folks can talk to each other about a person's care. One area on these two bars has doubled in size. It's the red one. Drugs, pharma. And I usually get a lot of jokes about bad pharma, but you know, a lot of the reason for the increase in pharma is a correlation to keeping people out of hospitals and the decrease in hospitalization. We have better drugs, we can treat people, we can keep them out of the hospitals and manage their chronic conditions, and we can treat them for their acute illness and get them out sooner and quicker and healthier. So this painting the backdrop of what we're facing fiscally, or what we need to be aware of fiscally, looking at where we've been, helps us determine where are we? Where are we going as hospitals? And this is where I said my colleague and I did not share notes prior, but you're going to hear a lot of the same words between the prior presentation and this presentation. Hospitals today, and California Hospital Association represents more than 400 hospitals in the state, health systems, standalone hospitals, rural hospitals, critical access hospitals, large academic medical centers, large systems like Kaiser, Sutter, Dignity, and others, public hospitals, the UCs, the county hospitals, district hospitals, children's hospitals, cancer hospitals. They all fall under the umbrella of CHA. Not every hospital can move at the same speed at the same time because they have very different characteristics that are driving not their desire for change. I think they all have the desire, but their ability. And it comes down to that darn allocation of scarce resources. So on the spectrum of hospitals, we have many that what I would call transformative leaders, really driving transformational change in healthcare. And there are those that just can't, but want to. But there is opportunity for every hospital in California and in the country, and I think California is so far ahead of many of the other states. There's the opportunity for hospitals to think about where they want to go and really develop that transformative vision of what could they be. Even if resources weren't an issue, what could they be and how could they get there? And then start putting together the plan. Now, most hospitals can't get there alone. It's going to require lots of shared values with lots of partners in the healthcare sector. A hospital provides sick care, but we have nursing homes, we have physicians, we have physical therapists, we have doctors in their offices, we have medical groups. All these need to work together with that shared vision towards caring for the whole patient. And together, those groups of providers can pursue what I call breakthroughs, breaking the mold of how we've delivered care for the last 50 years. Has anybody watched the movie? I think George C. Scott is in it. It's a 1970s movie. You can look it up on IMDb. It's called The Hospital. Well, I watched it, and it's about 5-6 years ago. And it's kind of the day in the life of a hospital CEO. And he's dealing with labor unions and a nursing shortage and too many people in the beds and can't get them discharged. And I'm just racking my brain going, wait a minute, have we not learned anything? And in some ways we haven't. We've learned a lot. I'm just kind of poking a little fun at my own industry because we have to do that. But we certainly can do better. And I think many are poised to do better. We have to focus on efficient care to the patient, safe care to the patient, and I think the previous panel did a really good job of this coming out in the Q&A, and that's convenient care for the patient. How do the patients want care delivered to them today? Some of them want a virtual visit on their phone. Some of them just want to stop in at the grocery store and see a clinic. They don't want to go to a hospital or a physician office. So we have to think about what this emerging demographic is demanding of all of us as leaders in the healthcare industry. And we have to transition from providing care to managing health. And I've had so many hospitals say, Ann, you say that, and it sounds like you want us all to be a Kaiser. Well, they can't all be a Kaiser, and I don't think that they all should be Kaiser. Kaiser has a unique place, and that's great. But that should not stop any individual provider, whether it be a hospital or a medical group or anybody else, from working on integrating the care that they're providing. And that's the direction we have to go. And to close this out, this last slide has 4 to-dos. If the hospitals just do this, they'll be there. So it's that easy. They always want a checklist from me. I'll say, here's your checklist. And I don't need to go over those because it's really just for fun, but just to summarize them, and I've talked about it a lot already, we've got to decrease utilization, decrease hospitalization, decrease the total cost of care to patients. We have to acquire expertise, including the technology that we heard about earlier today, yesterday. We have to acquire that technology to predict when people are going to get sick, to intervene before they get sick. And if they do get sick, yes, we have to treat them, because that's what we do. And it really comes down to, I think, long gone, yet not if you read the news lately, long gone are the days of mergers and acquisitions, the old M&A activity. Well, like I said, not if you read the news, but I think it has morphed into something different. It's not the typical M&A of the 80s and the 90s. I think you're seeing more partnerships, even more virtual partnerships to develop virtual scale and footprint. And that's not to try to dominate, it's finding ways to bring providers together, to leverage the tools that are available to provide the best care to the patients going forward. I'm glad I don't have a tearjerker because I was wiping my eyes from the prior. But thank you all very much for inviting me today. Thank you.